KVAL's Gold Meadows spoke with medical experts in our area today. Gold, what are they concerned about with the passing of this new budget bill?
Well, Kendall, nearly 12 million Medicaid recipients across the country could lose health insurance following today's passage of President Trump's spending bill. And that's according to the nonpartisan Congressional Budget Office. The spending bill, dubbed the Big Beautiful Bill by the president, calls for $1.1 trillion in cuts to health care, spending over 10 years, with $1 trillion of that coming from Medicaid. It also ushers in impacts to hospitals that provide care to Medicaid patients as those patients lose their ability to pay. Peace Health Oregon Network's chief hospital executive says the extent of that impact depends on what the state decides to do about it.
With billions of dollars in funding to keep the Medicaid program where it is right now, or cut people off the rolls of Medicaid. So if we end up having hundreds of thousands of people lose coverage, people don't get the care they need, they don't get preventative service, they end up coming to us sicker. Half the hospitals in the state of Oregon lost money last year. To be able to absorb a lot more free care delivery, which is what this would be, is going to be an extreme burden on the hospitals.
Last year, large swaths of patients in Oregon hospitals were covered by Medicaid. More than a quarter of patients for McKenzie-Willamette Medical Center, more than 28% for Bay Area Hospital, 26% at Peace Health Riverbend, and nearly 14% for Lower Umpqua Hospital. Becky Holtberg, president and CEO of the Hospital Association of Oregon, releasing the following statement today. This bill will have catastrophic impacts on health care access and affordability in Oregon. Hundreds of thousands of our friends and neighbors could lose their health coverage. The state will need to find ways to address billions of dollars of lost federal funding. For Oregon hospitals, these changes are coming at a time when the health care system is teetering on the brink of financial failure. Our focus now is on solutions that help hospitals keep their doors open so they can continue serving their communities. Now, Medicaid provides insurance to both disabled and low-income people, and in Oregon, about 1.4 million people are on Medicaid.